Hi, I am Dr. Ramen Goel. I am bariatric surgeon at Mumbai, India. We run a center of bariatric excellence to only manage bariatric and metabolic surgery patients. Now, there are always doubts in people's mind why they should go to one particular surgeon or a hospital or a country, why they cannot get it done in their own country. Obviously, there are multiple factors. One of them is money. But I think what is more important than money is your safety or your patient's safety. India provides a kind of environment where there are very well trained surgeons who are working in world-class hospitals. Now, some of these doctors do go to USA or UK or Australia to, they start working there. But majority of the well-trained doctors stay back in India. And thus, when you take a decision to travel for bariatric surgery, the most important thing to determine is the outcomes of the surgeon with whom you are getting operated. Because safety is paramount, and that is what we can offer at Mumbai in India. And the safety is not about how safe is the surgeon. Safety is all about how well trained nurses are, how clean are the beds, how clean are the toilets, how safe it is in terms of staying in a hotel. And most of the hospitals that we work in provide a comprehensive safety cover. When you go there, these are the hospitals, like I mentioned, which are like JCI accredited. They are internationally accredited hospital. That means every nurse, every doctor who come in contact with you is trained very well. They are accepted nurses who could be working, who could have worked in a hospital in US, and they are working in our hospitals. The sanitization, the autoclaving of instruments, the use of consumables, there is no compromise in the quality. So when you find some other country which is offering this same surgery in $500 or $1,000 less, please look up whether everything is the same. Whether you are going to a hospital which is accredited worldwide, internationally, like a JCI accreditation or national accreditation. What are the qualifications of the doctors? With what kind of sanitization they use, and what kind of consumables are used. So most of us use only consumables from, let's say, companies like Johnson & Johnson, Medtronic, and likewise equal quality consumables. All this comes at a price. So if you try to reduce the price to a very low level, you are probably compromising on your own safety. But if you accept a decent medium level pricing, which is offered by most of the hospitals as a package, it ensures that you travel back to your family safe and in good health. And in bariatric, it is all the more required, because bariatric is not only about getting the surgery done, but bariatric is about getting the surgery done in a perfect manner. So if you get a gallbladder removed, that's the end of the story. But in bariatric, the story doesn't end after the surgery is over. In bariatric, the story remains with you for life, that you should be able to lose weight and maintain weight even 20 years after surgery. That is only possible if surgery is done perfectly. Everything, whether intestines are measured properly, whether the stomas that are created are perfect. So bariatric is like a cancer surgery, where either it is perfect or it is not perfect. There is nothing else. So please look up at all your options. Do not get carried away by something which is very cheap, because it's only your life which is important to us. And if there is any questions in your mind, feel free to contact us, and we will be able to help you with all the answers. And then staying on the pricing part of it, the icing of on the cake is that in India, like in our program, the surgery would cost about 20% of what you will pay in a developed country like UK or US. And this is the average pricing in average hands. If you match apple to apple, if you are looking at the best of the surgeons in US and senior surgeons in India, the difference in price is almost 85 to 90%, because there it may be costing almost $40,000 in the hands of the very good surgeons, and in average hospitals it's about $25,000. So I think pricing wise also India is a good destination, and even if you add the travel costs and other expenses, it's not even 40% of what you pay in a Western country. So I think it's a wise decision to travel for safe surgery in the best of the hands in India and at an economical cost. Thank you.